Allow me to the Surgeon General Initiative Health Webinar Series and the holiday season. I know many of you are preparing to be with family. Travel in the age of COVID-19 is complicated, whether you're flying, driving, busing, or otherwise. However, there are many other health risks about which you should be aware, and that's what we'll be discussing tonight. Many of these and other types of precautions, as well as how you can best lower your risk. On behalf of Alpha Phi Alpha's General President, Brother Dr. Willis Lonzo III, I am Dr. Jeffrey Sterling, Surgeon General for Alpha Phi Alpha. We welcome back tonight as our moderator, Alpha Phi Alpha Fraternity's Deputy Surgeon General for Public Health, Brother Dr. Robert Carter. He is a doctorate and a colonel in the U.S. Army, in addition to being our Deputy Surgeon General for Public Health. He also serves as an adjunct full professor for the Department of Emergency Medicine at the University of Texas Health in San Antonio, Texas. Brother Dr. Carter obtained his postgraduate education at the Harvard School of Public Health and the University of North Texas Health Science Center. He is a fellow of both the American College of Epidemiology and the American College of Sports Medicine. Welcome, Brother Carter. Have a great show.
Thank you, Brother Dr. Sterling, for that warm introduction. I'm really excited today about our session tonight. We have a wonderful set of speakers tonight. Our first speaker tonight, panel member, is Dr. Higgins. He is the Executive Director of the Black Psychiatrists of America, President of the Black Psychiatrists of Greater Houston, past President of the Caucus of Black Psychiatrists of the American Psychiatric Association. He has worked with and founded programs to help direct inner city youth, as well as women, to inspire them to go to college and finish their educational goals. He's also worked with countless community mentoring programs and has a special interest in trauma, racism, and inner city issues, specifically how these issues affect minority and disadvantaged children and communities. Dr. Higgins is the co-author of several books. One specifically I would like to mention, an international bestseller, The Mind Matters, a resource guide to psychiatry for Black communities. He received his MD from Meharry Medical College in Nashville, Tennessee. He completed his residency in adult psychiatry and his fellowship in child and adolescent psychiatry at the University of Texas Medical Branch in Galveston. And then we welcome also Brother Dr. Narcisse, who grew up in New Orleans, Louisiana, where he developed a love for the history, jazz, and culture. He graduated from Jesuit High School, summa cum laude. He attended Tulane University as a Dean Honor Scholar and was recognized with the Merck Prize in Chemistry. He also graduated cum laude with the departmental honors in biological chemistry. Dr. Narcisse is a spring 1990 initiative of the newly founded Rho Iota chapter. In 1993, he moved to Texas Medical Center in Houston, where he completed medical school, internal medicine residency, and geriatric medical fellowship from Baylor College of Medicine. He is also board certified in internal medicine and geriatric medicine. He practices at the Houston Methodist Hospital in Houston, Texas, as the Associate Division Head of Hospital Medicine at Houston Methodist Physician Organization Group, as well as the Director of Clinical Research in the Division of Hospital Medicine. He currently teaches medical students from Texas and the internal medicine residents from Methodist Hospital. He recently completed a term on the Board of Directors of St. Dominica Village, operated by the Archdiocese of Galveston, Houston, and continues on the advisory board. Dr. Narcisse is a life member and remains active in Alpha Eta Lambda chapter. He serves as the Deputy Surgeon General of Alpha Phi Alpha Fraternity. Tonight's discussion is dedicated to the late Brother Timothy Benson. Tim was an extremely successful psychiatrist and author and motivational speaker. In his private practice, he specialized in treating elite athletes, high-performing achievers in academia. He was a clinical instructor in psychiatry at Harvard Medical School for over 10 years and was the medical director of several addiction centers across the country. He co-authored several international best-selling books, Specifically, he was a co-author with our speaker tonight, Dr. Higgins. And he was really inspirational to my book, The Morning Mind. Unfortunately, Dr. Benson passed away around this period of time from an aneurysm at the age of 47. And so in military tradition, when we lose a member, we place a small table set aside for one. And this symbolizes the isolation of that member and allows us to recognize them in a special way. So again, Dr. Benson's story is truly an inspiration for many of us as we endure travel in this era of the pandemic. According to a survey online conducted by a health and wellness information organization, more than 60% of respondents said they feel some level of stress and anxiety during the holiday season. And the primary causes for this include financial issues, healthy eating, travel, and schedule, and the risks associated with the pandemic. The coronavirus of 2019 pandemic has impacted people of color disproportionately. SARS-CoV-2 infection rates, hospitalization rates, and death rates among Black and other minority populations in the United States are 2 to 3 times higher than that among white populations. While this disproportionate physical health toll remain documented, limited data suggests the pandemic may have disproportionately affected African Americans during the pandemic. While work, family, financial, and a combination of other factors, it's important to identify your health risks, specifically during the holiday season. Stress, emergency room visits, heart attacks, mental health emergencies, seasonal affective disorder, what's so-called Merry Christmas coronary, overeating, and medication refills contribute importantly to this stress during the holiday season. Given the challenges, many Americans will ask themselves a fundamental question: should I go or should I stay? So my first question tonight is for Dr. Narcisse. Is it safe to travel during the COVID-19 pandemic?
Well, good evening. Thank you for the kind introduction. As is often the case, the answer is it depends. I think it's a choice that everyone's going to have to make. But given that we've been unable to travel over the last year or more, as easily, I think many people will choose to choose to travel. Some things that you can do to reduce your risk is obviously being fully vaccinated. If you're eligible for a booster, I think that for COVID-19, I think that's something you should do. But similarly, everyone should consider their vaccination status for influenza and pneumonia, because those things can also impact your risk. I think that if you wear a mask over your nose and mouth when you're in indoor activities, particularly in public transportation, I think that that's something that can dramatically reduce your risk. And I think it's something that's recommended fairly ubiquitously. But you should also consider getting tested for COVID-19. And if you've been, if you test positive in the day or several days before your travel, maybe you should reevaluate your risk and consider not traveling. That might be best. So testing, masking, vaccinations. Additionally, you should know all the rules and regulations, requirements that your destination might have. And in particular, you should pay close attention to those who can't make decisions for themselves because they're not fully vaccinated and they're below the age of where that's allowed. Infants have difficulty wearing masks sometimes. And if you're traveling to places with a spike in COVID cases, maybe you should think very carefully. Similarly, you should monitor yourself for symptoms. And if you're not vaccinated, you should get tested again after your travel.
Thanks, really appreciate that. So while we are equipped to protect ourselves, would you like to make a comment on what about mixed populations? What's the risk of spreading kind of COVID-19 when we intermingle, when we have a mixed crowd of vaccinated and unvaccinated people. Would you advise that, or what are some ways that we can minimize spread among family members and friends that may not be vaccinated or cannot be vaccinated?
I think this is going to be the question that the entire world is going to ask itself over the next several days, next several weeks, next several months. How do I manage the risk when I'm traveling with to family members, spending time with family members who have a different set of choices? And I think that it's very difficult, very complicated. Again, if you're indoor activities, you should probably wear a mask. I think that's probably the first thing to do, and I think it's the easiest way to reduce your risk. Again, you probably can't change your vaccine status immediately, but if you haven't gotten your COVID shot, gotten your complete COVID series, and if you're eligible, your COVID booster, those are things that you should try to do as expeditiously as possible so that you'll have complete immunity before the end of the holiday season. And again, traveling, you may live inside your own bubble and everyone is either infected or not infected, vaccinated, not infected, not vaccinated. But when you mix these groups, this is what the super spreader events that you hear about. This is why you'll see likely an increase in COVID cases after Thanksgiving, after Christmas, after New Year's, because of this intermingling.
Again, really appreciate that. Now I would like to really turn to Dr. Higgins. Again, we have heard that Black Americans, African Americans have been disproportionately affected. We also know that there's a history of systemic health disparities. And I would like to ask Dr. Higgins to comment specifically on some of the negative psychological effects of quarantine during the pandemic, specifically, among those family members that may choose to stay at home because they're unvaccinated or cannot be vaccinated, and the toll that it may take on some of those members not being able to see their loved ones. In particular, when we think about how important community is in Black community, those grandparents that are not able to see their grandkids. And, if you could just make some comments about that.
Well, definitely so, Brother Carter. And it's difficult times right now. When we look at the families and, and the stress that is going on, typically what we do in the Black community and in most communities, we're able to come together. So there's a stressor, then we come together. There's a stressor, we come together. There's a stressor, we go to church. We go and meet over someone's house. And so that ability to do that has greatly impacted how much this virus has impacted all of us. And all of us are dying to get together. We want to see each other. We want to love on one another. You want to be in the presence of one another. And we are communal people. So the fact is that with us not being able to do that is greatly pulling on us. So the question becomes, how long can we stay apart before we start losing it? Because, isolation will kill you. It is a stress on the body, and it's something that you're not able to do where you're in complete isolation. So how do we get together? How do we stay safe and get together? It becomes the continual question. Are we doing all that we can do in order to do that? So what makes the holidays even, also tricky is that it's colder outside. So we're inside more. We're seeing this uptick in virus because this is viral season. This is where people are indoors and not outside. They're communing in close quarters. You're not able to eat in the patio of the restaurant and things of that sort. So now it's causing us this virus to grow bigger. So we have to be very careful about what we do. We have to consider the risk, but we also can look at the things that we can help to try to mitigate some of that risk, including, as Dr. Narcisse has stated, my colleague here in Houston, is that we need to make sure that we are vaccinated. If you have the chance for the booster, go ahead and get the booster. Also, but when we come together, also you have those family members who are not vaccinated. You have people who still don't believe that COVID is something real, and that becomes a problem as well. So we have to look at how can we mitigate some of those risks inside of our home, which some of that would be making sure that people wash their hands. If you're not eating, make sure you wear your mask. Try to encourage people to be vaccinated and trying to take all the safety and cleanliness measures that you can do, but realizing you are taking a risk when you put everyone inside the home and from different houses, different states, different backgrounds, it increases the level of risk that someone can get sick and unfortunately pass away.
Yes, no, I'm glad you mentioned that. You know, the stressors of the pandemic and some of the independent stressors that are well documented. A recent study published in Psychiatry reported African Americans report seasonal changes in mood, energy, appetite, weight loss, sleep, and that ethnicity may be a major driver of depression and mental health, and that could worsen during the winter months. So Dr. Higgins, I would like you to comment specifically what is seasonal affective disorder and how much does it contribute to holiday stress, given also the context of the pandemic?
So seasonal affective disorder is a disorder that happens during the fall and winter months where you have less sunlight. People are going outside less. Some of that's because it's cold, because it's getting darker quicker. We're doing less activities outside. And then also on top of that, you have the issue of the stress of the holiday season, which can be very stressful to individuals. So the thing is that it tends to be seasonal and that people can almost predict that, say, September, October, or going into November, that's a dip in my mood, and then it seems to get better when the spring occurs. So ways to mitigate that is when it's sunlight outside, go and get some sunlight. All right. When you have some time, you're off early from work, make sure you work outside and try to take a walk, or even on the weekends, get some more sunlight in on your skin. Also, taking vitamin D can be helpful, and that your vitamin D is a hormone. We call it a vitamin, but some would refer to it as a hormone. That when this ultraviolet rays hit your skin, it helps your skin then to produce vitamin D. And vitamin D levels can be lower in African Americans simply because the darker your skin, the more your skin blocks sunlight. So we have to make sure that our vitamin D levels are right. But then the other part of that was that we have to make sure that if we're having a struggle or issues with depression, go ahead and get some treatment. You may need to go and talk to your doctor about that. And then the last thing that I'll mention about that is that holidays are a time for reflection. So as you had mentioned, Dr. Timothy Benson, who was a very good close friend of mine, and honestly, when he passed away, it felt like a close family member had passed, especially with the work that we had been doing on the last. Me and Tim have 3 books together, and we had started this plan together, and unfortunately his life has been lost, and he's gone on to the ancestors. Unfortunate for us, but gain for him. And so this is a time of reflection where you start to miss those family members who were there. So at the age of 50, going on 50, the holidays don't look like they did when I was 5 or 10 or 15 years old. There's several people who are no longer here. So that reflective period also causes a stress during this period of time. And I would say Christmas just isn't the same as you get older. The things that used to be there are no longer there, and there's that longing for that, or that need to be able to commune, for physical touch, to share with one another. And then on top of all of that, which is normal for the stress of the holidays, we also have the pandemic, which is preventing us from doing as we would normally do as well. So this has gotten to be it's much. It's not a little bit, it's a lot. And it's gotten long. So the chronicity, how long it's gone on, is now causing problems where we're seeing that over deaths in the U.S. have hit an all-time high. That fentanyl overdoses have hit an all-time high. There's discussion in the psychiatric community that we have a stressor when it comes to children and their mental health, and that we're in a crisis right now. So this has gotten long, and it's going to be more important that we pay attention to what's going on with ourselves and with our families when it comes to our mental health during this seasonal affective disorder season, on top of the holiday season, on top of this growing continual concern of the pandemic, which sadly is now getting worse because of the season that we're in right now. This is viral season. This is the season where we catch these things.
No, I really like the fact that you touched on the kids piece, because again, this is the period of time when many Americans, many families get together. They look forward to gift exchange and the financial challenges. We hear more about inflation. All of those factors really contribute to stress. My next question is for Dr. Narcisse. What kind of chronic issues can develop or be exacerbated from stress during this holiday season?
We certainly worry about a number of conditions. The one that we worry the most about is coronary artery disease. It seems like it goes up during the holidays. whether it's the emotional stress, the lack of physical activity that we mostly have. Some people are in colder climates are actually doing more physical activity because they're trying to walk through snow and sort of inclement weather. And so we actually see more heart attacks during Christmas and New Year's than really any other time of the year. But we actually notice increases in a number of chronic conditions: congestive heart failure, end-stage renal disease. People tend to eat more sodium during the holidays, and as a result, they hold on to more water. And if you have congestive heart failure or if you have end-stage renal disease, it becomes very difficult to eliminate all that water, and so they'll have problems with breathing. Additionally, we worry, as we mentioned, respiratory illnesses because of viral contacts, and again, more time inside, mixing populations that we don't ordinarily mix because we're not traveling as much other times of the year, are things that we certainly worry about.
Again, I really appreciate that, and I'll jump to my next question. There's a phenomenon that's referred to as Merry Christmas coronary, and also one which is one of the days that we see the most number of heart attacks, and is referred to as Happy New Year heart attack phenomenon. What are the risks, and what are some of the symptoms and signs that an individual may experience, or may what are some of the signs, and what are some of the things we should really be on the lookout for in ourselves as we're getting older, and family members that we may be around during the holiday season, things that we can actually do that may allow them to get to the hospital in time to save their lives?
Certainly for coronary artery disease, someone's having a heart attack, we worry about chest pain, particularly if it's in the middle of the chest or the left side of the chest. If that chest pain radiates or spreads down the left arm, up to the neck, up to the jaw, associated with difficulty breathing, dizziness, nausea, vomiting, kind of a feeling of lightheadedness and really sweaty conditions. Those are some of the symptoms that you'll have. But you'll notice that a lot of those same symptoms are experienced by me if I'm working out more than I'm accustomed to. And a lot of times during the holidays, we're doing more physical labor, whether it's cutting lumber or we're shoveling snow, walking greater distances from place to place. A lot of people are in a lot of environments are doing more than they're accustomed to doing, even during their regular lives. So those are the kinds of things that we worry about. And so this is an important time. And though we didn't specifically ask about it, one of the things I'd like to just mention is that the holidays are a great time that you should, when you're spending time with family members, you should know their family history. This is a time not just to talk about what does somebody wear or challenges that people are having, but get to know your family's history, your family's medical history in particular. What kinds of cancers do they have? Do they have heart disease? Do they have kidney disease? Because that might affect your risk of developing these same problems. And if you know that you're at risk for developing a heart attack because your parents, your aunts and uncles, your siblings have had these kinds of medical problems, particularly earlier in their lives, then that might mean that you need to do different things in terms of your target blood pressure, your target cholesterol, your target activity. So those are the kinds of things that I think is really helpful during the holidays. Talk to your family members, not just about the usuals, but get to know their medical history, and not to be nosy, because in my family, everyone wants to keep secrets, but you're trying to do it to understand your risk and the risk of other family members, so you can react more swiftly in terms of the preventive medicines and preventive actions.
No, I really appreciate that. In fact, when you're describing some of those signs and symptoms, I thought about, I'm also from Louisiana, and I thought about a lot of the signs and symptoms sound like my uncles after they engaged in too much fun activity during the holiday season. So definitely I appreciate you sharing those, because that may contribute to individuals helping loved ones get assistance and emergency attention before it's too late. we solicited some questions, and this is a question from the audience. And this is for Dr. Higgins. I often find I have little patience during the holidays. I get easily angry over really simple things, small things. And then when the holidays are over, I feel crazy. If people find themselves feeling like this, what should they do?
Well, as stated, the holiday season can be very difficult. It's a time of reflection. A lot is going on in our minds and our heads. And so trying to identify what can be at issue is something that we need to pay close attention to. For example, I lost my mom about 5, 6 years ago. I noticed that typically around the time that she passed away and her birthday, which is the day after Christmas, I noticed that my irritability picks up, all right, where I get short with individuals, especially the folk that I love. So what is that tied to? Well, that's tied to the emotion of bereavement. And that is a very powerful emotion that many times we don't pay close attention to, that manifests itself in multiple different ways. We have to look at issues of depression and seasonal affective disorder. Those can manifest themselves in different ways, and that we assume that if I have issues with missing or longing someone, that I'll feel sad or that I'll feel down. And your body is full of different emotions, and sadness and down may not be your emotion. Some people have irritability or anger, or some people even feel aloof, towards everything, where they don't feel much of anything. So I tell people, give yourself room to not be where you expect, to not be what you would expect yourself to be. In that it's okay to feel down sometimes, it's okay to feel aloof sometimes, and it's okay to feel a bit irritable at times, especially during these pressured periods, because the holiday season is a pressured time. We have, financial obligations, so far as, being Santa Claus and people coming over the house and the stress of having to travel and fear of getting COVID. And then you don't want to be the one who showed up to the party, to Christmas, and you got grandma sick and she died. You all of these stresses are going on, and I tell people, give yourself room to be stressed about it. It's okay, but you want to recognize what the stressor is, and sometimes that can cut down on some of the frantic type feelings that we can have during these holiday seasons. So I would say give yourself room, but if it's continuing an issue, or if it starts to impair, so you don't want to be the person that went to Thanksgiving dinner, got into an argument, and the turkey ended up on the floor. So if it's starting to impact your ability to associate, to come around your family, or for you to do what you need to do in life, at that point, I'm like, you need to go in and get in to see a professional, and that you have some other issue going on at that point, and in which you have to be worried about the issue of clinical depression or seasonal affective disorder that looks a lot like depression, that is basically the same thing, but it seems to happen around the fall and winter months. We always have to keep an eye out on that.
I really appreciate you sharing your thoughts on that. And I want to basically touch on a condition. About 2 years ago, one of my good friends traveled back to Nigeria, and on the flight back, he developed this condition that ultimately led to some heart issues about a year later. And I would like Dr. Narcisse to share his thoughts on a condition that is called deep vein thrombosis, who's at risk, and what are some of the dangers, and are African-American men more at risk of DVTs, and just any additional information that you'd like to share on that topic.
Thank you. So deep vein thrombosis is a condition where clots will form predominantly in the legs. It can happen in the arms, but mostly in the legs. The people who are at highest risk for those kinds of conditions are those who have had clots before. So there are changes in the lining of the blood vessels. Additionally, if you have cancer of any type, you're at higher risk. Certain individuals have a family history. Again, hint, hint, know your family history. If you had a family history of having clots, that might be something to be aware of. Particularly, people may not even know that family members have had clots, but they may have had clots and had loss of pregnancies along the way. Sometimes that happens in the setting of clots. So again, clots happen. They form in the legs. especially happen this time of year if you're traveling long distances, if you're sitting for longer periods of time. We see this often. And so if you actually travel on an airline, if you look through the safety card, many times in the back, somewhere tucked in, after something around water landing, they'll speak to doing some exercises while you're sitting, getting up and moving around the cabin when that's available. If you're driving, getting up and walking periodically. Also, if you're sitting long periods of time, there's some exercises that you can do, rotating your ankles, lifting your legs, that can sometimes be helpful. And again, if you're traveling by airline, they'll often outline those because they worry about this and worry about people getting clots. If you get a clot, it may be very, very painful. Your leg might be swollen. Usually it'll happen in one, though rarely and occasionally it can happen in two, less commonly in the upper extremities. And these clots will form, again, cause a lot of pain. And we worry about those clots traveling, parts of those clots traveling, breaking off and traveling towards the lungs and causing pulmonary embolism, a condition where it becomes very, very suddenly and very, very potentially painfully difficult to breathe. And that can be life-threatening. You've heard in the news people who will die suddenly. Occasionally that will be because of blood clots that started in the legs and traveled up to the lungs. African American men are particularly at risk because we're at risk for almost everything that's bad, and so you can't change your genes, but you can change what you're doing. And so things like smoking will also increase your risk. So that's something that we can specifically try to avoid. Women who are taking hormonal therapy for birth control may have an increased risk, so they should always speak with their physician, their prescribing physicians about that, and so they understand their risks. The fortunate thing is that deep vein thrombosis has gotten more readily treatable. We used to have to start with medicines by vein and use medicines by mouth that were very, very sensitive to levels and would have to change the dose very, very frequently. The newer medicines that have come out are much less sensitive to that. And so you can take the medicines, whether it's once a day or more commonly twice a day, and then it doesn't require as many lab tests and adjustments. And so that works very, very well. You can live your life, you can work, you can exercise. You can't do sword swallowing, or you can't juggle chainsaws anymore. A number of high-risk activities where you might fall, cut yourself, bleed, or fall, hit your head and bleed inside your skull are probably not advisable, but most other things you can do. In rare situations, deep vein thrombosis can cause clots that will travel from one part of the heart to the other part of the heart because of a hole in the heart that was previously unrealized or unappreciated. Less commonly, the clots will form on the exiting part of the heart and will travel up to the brain. So that can happen. And so these clots traveling to the lungs cause your lungs not to work, pulmonary embolism. They can cause heart attacks. They can cause strokes. So we certainly are very concerned about deep vein thrombosis. Again, if you're traveling, this is one of the risk factors that you can modify, get up and move, do exercises. If you're smoking, please don't do that. Try to avoid drinking excessively. Those are some of the things that you can do.
Again, thanks for those comments. My next question is for Dr. Higgins, and thanks again, Dr. Narcisse, for your comments about excessive drinking and some ways that individual may choose to decide to deal with anxiety and depression during the holidays. The question I have for Dr. Higgins, I would like you to comment on how does holiday blues differ from general mental illness, and can holiday blues lead to anxiety and depression after the holidays?
Yes. So holiday blues is, where people feel down, they don't feel themselves, they don't feel their normal selves during the holidays. And you have to differentiate that from depression, because depression is where you have an illness. So when I think depression, I'm thinking a loss of function, where you're not able to work, or you're not taking care of yourself, or not able to take care of your responsibilities. So while some people are getting hyped up for the holidays, some of us do not get as hyped up because of the stress of it all. The financial obligations, the travel. I know for many of us, even though the holidays occur, sometimes the life is busier during the holidays, and that can cause a drag on the whole situation, and that we're not looking forward to it. And it's like, if we could just get past the holidays so I can move on to the rest of my life. It's how many people how they go into it, versus when you have the issues of depression, is when you have the sadness, hopelessness, sometimes even suicidal thoughts, lack of energy, not sleeping, a lot of guilt, or feeling worthless. And at that point, you're looking at a clinical issue that may needs to be looked at by a doctor and actually treated.
Again, I really appreciate those thoughts. We talked a lot about how the pandemic, how the holiday season can impact our mind, our emotions, as well as our bodies. So I'd like to switch a little bit to looking at some ways that we can help mitigate some of these factors. And my next question is for Dr. Narcisse, and that is, are there healthy, quick foods or snacks that we can eat when we're on the run on the holidays? Specifically, what are some things maybe that I can eat if I decide to drive to see grandma, if I'm on a flight? Just what are some ways? Often we find ourselves stopping to Burger King, Popeyes, getting unhealthy food along the way, and then spend the holiday season typically eating unhealthy food possibly. So what are some things we can do to maintain our energy levels and safely make it to our journey?
You can usually have quick, you can have easy, and you can have healthy. You usually can't have all three of those at the same time. But there are some tips and some things to think about that can really help your energy. Some of the things are the ideas that you probably heard around your kitchen table since childhood. Having a healthy breakfast is one of the great ways to start your day. When we're traveling, it's difficult to eat sitting down and eating large meals when you're on the road, but having frequent small meals can be quite helpful. What are some of the things that we can do? Carbohydrates are often challenging. When you usually think about carbohydrates, you're thinking about sweets, candies. Those are probably to be avoided because they make your sugar go up and then crash down low. But if you have whole grains, brown rice, cereals, wheat bread, those things can be quite helpful. And so I like to take a healthy cereal and put it into Ziploc bags. And that way you can, instead of reaching for a candy bar out of a vending machine or in the airport terminal, that's something that could be quite helpful. Doesn't have to stay refrigerated. Could be useful. Similarly, nuts. I always worry about nuts and cholesterol, but certain nuts, cashews, almonds, walnuts can be quite helpful because of the protein. Brazil nuts have high levels of selenium. It's harder to eat lean meats like skinless chicken. You mentioned Popeyes, one of my favorites. Growing up, probably not the best for my long-term health. It's challenging to eat things like salmon, but if you can get a salad with salmon or with skinless chicken, those things can be quite helpful. The chicken is high in tyrosine, turkey's high in tyrosine, salmon's high in omega-3 fatty acids. Those are great things. Green leafy vegetables. So again, if you're going to stop and eat, having dark green leafy vegetables is quite useful, quite helpful. Fiber, beans, fruits, vegetables are great things. So again, pre-preparing snacks in bags that you can travel with fruit, dried fruit can be quite useful. Those are great things. Hydrating yourself is always an important piece. We never drink enough. 64 ounces of water is what we always talk about. Harder to do when we're traveling. Everyone's worried about, can I find a bathroom in time? And usually people will, as we get older, will start to cheat their hydration. So those are some of the things that I think are useful to start. It's usually not quick, easy, and healthy, but I think if you pre-plan and prepare, you can actually have with you things that are tasty, filling, and good for your health.
Now, I really like the fact that you touched on water. That was the question I was definitely going to touch on, because a lot of the research suggests that individuals don't drink enough water, and in particular, communities of color tend to drink actually less water, which may contribute to some poor outcomes and certain health conditions.
And the other thing, Brother Carter, the other thing that happens is during the holidays, we tend to start to substitute water for other forms of hydration, like alcohol. And alcohol actually dehydrates the body because it makes one eliminate fluid as opposed to hold on to them. So I think that hydration becomes even more difficult. And I mentioned the challenges that members of my family have always talked about. No, I can't drink that water because I'm about to get on the road and I can't find bathroom fast enough. So I think the hydration is a critical point.
Yeah, no, and I really appreciate that. And just thinking about the impact of the pandemic, how and individuals, within the African American community, and one of the first organ systems that to be impacted, and particularly if you have any kidney disease, is impacting the kidney. So probably the last thing you want to have is to be severely dehydrated for prolonged periods of time, and then unfortunately contract COVID. It's probably a situation that could result in some acute and potential long-term problems with kidney function. My next question is continuing along the lines. Over the holidays, we tend to really, in particular, folks from Louisiana and the South and other parts of the country, really engage in eating. And my question is really for Dr. Higgins. What is emotional eating, and how can we control that during the holiday season?
That's a good question. How do you control emotional eating? Maybe Dr. Narcisse would be better at showing y'all how to do that. No, I'm joking. When I come to the idea of how to not emotionally eat, it's very stressful. So whenever you have stress causes an increase in cortisol, and cortisol causes increased release of insulin to the bloodstream, and insulin actually can disrupt your hunger feelings and how much you want to eat. So the problem is that the stress on the brain actually causes you to be hungrier, and some of that is a primitive state that we go through, where essentially that was a time when food was not so abundant. So whenever your body had stress, it would try to increase the amount of food you ate, because you had to prepare your body for not being able to get to what you need to be able to do. So there's a stress reaction to actually, when I'm stressed, I want to overeat. Some people undereat, some people lose weight, but many of us actually gain weight because of such the abundance of food, and food feels good. So essentially, if I, just thinking of I lost my mother-in-law who used to cook a nice gumbo out of Eunice, Louisiana. So essentially, I know that if she cooking gumbo and I got the rice and I got me a big bowl, I don't have any pain at that point. I don't have any worries, because the fact is that food makes us feel good. So it actually causes our bodies to release dopamine into our brain, and we feel wonderful at the time. The problem with that is that it's not sustained. So essentially, we feel this high, but then, as we stop eating, it drops back off, and then we need to get high again. So food is very powerful, and I tell folk, I don't care how much you miss your grandmother. No one who has the styrofoam plate with the chicken and the ribs and the green beans and the mashed potatoes and the cake inside of the plastic bag, no one eating is crying at that point, because food is that powerful and it changes how we feel. So during the holidays, it's even more stressful, which causes us to eat more food. But then on top of that, there's an abundance of food, because when people get together and commune, they like to commune around food. It's like, if we're going to have a party and there's no food, then it's like, how is this a party? There's no party without food. So as we get together, we eat more. The stress causes us to eat more. There's an overabundance of food during these periods of time, and it's hard to fight that off. So what I tell people is when you're looking at the holidays, pay attention to the idea that I want to eat to feel good, but also you have to pay attention to the idea of there are certain things I'm not going to eat. So as Dr. Narcisse had referred to, the issue of making sure that you have a plan on how you're going to eat, that you go over that plan with yourself and try to stick to that plan. Make sure that you consume enough water, because a lack of water causes people to feel hungry, because so much, about almost half of our intake of water is through the food that we eat, because all food has water. So you don't want your body consuming food to get the water, or you don't want to be stopping at Popeyes getting the chicken so that you can get to the red soda. All right, because at that point your body was thirsty and it's trying to get you to the places where it gets you more hydration. Make sure that you include raw fruits and vegetables into your diet. I know that it's, when on the road, everywhere has a grocery store. There's a grocery store. Every small town has a grocery store. Everywhere has a grocery store. I like to grab me a bottle of water, rinse the fruit off, and you can eat on the road to wherever you're going. So we have to be careful of this communal eating where we start to eat too much. And so often people think about, well, I ate too much over Thanksgiving. Well, now that we're communing together as friends and family, Thanksgiving is going to start the weekend before, where we ate wrong that weekend before. We ate wrong Friday, Saturday, Sunday. Many of us are off work, so we ate wrong Monday, Tuesday, Wednesday. And then we had the big Thanksgiving meal. And I know, I don't know, man, I'm just telling myself, normally I'm going to eat 2 or 3 of those in one day and watch the game and fall asleep on the couch. So we have to be very careful of that and be intentional and directional about our eating, and saying that we're going to eat raw. We're going to get the raw fruit and vegetables in today, no matter what. We're going to get the water in today, no matter what. We're going to exercise and we're going to walk today, no matter what. And we can even do that on Thanksgiving, where you get those good things in you. Also, when you're paying attention to the Thanksgiving meal, you could get, the turkey is going to be lean protein. All right. Realize that ham is not going to be lean protein. There's no lean protein, and there's nothing lean about ham. But getting plenty of the turkey, or if the person has cooked fresh vegetables, not out of the can, but if they cook fresh vegetables, make sure you get plenty of the vegetables inside of your system, and trying to limit those things that are high in starch and whatnot, because you can actually put plenty of those things on your plate that are actually good for you. And also for people who are cooking, having good, healthy options is a part. You can make that a part of your Thanksgiving meal. Everything does not have to be all starch and all, you don't have to put ham hocks in your greens. You really don't. There's a way, there are other options to where at least the greens can be healthy, So we have to look at how we're preparing the food, what available foods we have, but also having an actual plan and not making Thanksgiving a 10-day event. So if you're going to go in, but try to go in that day and not the 5 days before and the 5 days afterwards.
Again, brother, that's some great information, some great insight. Again, there is a way to enjoy the holiday season without basically ending up in the emergency room. And I really appreciate you really talking about that whole food dinner where you're getting those vegetables in, but also really enjoying the rest. And again, the often that quick way of at least feeling some degree of nutrition is grabbing that fruit. But again, you may also have that desire to have something else as well. My next question is another aspect. So we're talking about, we talked about food a bit, and then the other aspect of our health that tends to suffer during the holiday season, that's sleep. Especially being from New Orleans, brother Narcisse, it's often difficult to have sleep. As we enjoy festivities during the holiday season, especially if you spend some time on Bourbon Street down in New Orleans. Any recommendations on how important it is to maintain your sleep schedule, and if you would like to comment on comment a bit on how sleep disruption may increase the risk of being admitted to the hospital for certain chronic conditions?
Yeah, we see this often when we're traveling. even if we're at home during the holidays, we tend to have a different schedule than we would at other points in time. And I think that that's one of the things that seems to contribute to the coronary events, changes in your circadian rhythms, and increasing your risk of having troubles, particularly the holiday heart syndrome that we talked about before. And so I think that it's very, very important that when we're traveling, that we're stopping, we're not driving excessive periods of time, we're not behind the wheel when we're asleep. I know that everyone's in a rush to get home, to get to grandma's house, to get to their mom's house. And so traffic in Houston and Louisiana, I'm sure all over the country, is just horrendous this week, this upcoming. So making sure that you're not behind the wheel with an insufficient amount of sleep is critical. Again, we talked about the connection of sleep, circadian rhythms, and coronary disease and the holiday heart syndrome. So those are some of the things that we really want to emphasize.
Again, great comments on in that regards. I would like to talk about something that unfortunately happens quite a bit. In particular, individuals travel away from home, either by air flight or by car, and it becomes quite a stressful, emotional event. And that is often either individuals will decide to stay a little bit longer, or in between that time, they will forget to get their prescriptions refilled before traveling. So, Dr. Narcisse, if you could just talk a little bit about, if an individual forget their medication at home, or they decide to stay a little bit longer away from home, how would they go about getting medication refills? And I would like to speak specifically to individuals that may be needing medication refills in a narcotics room. We've heard a lot about just recently about, we're continuing a record number of deaths from fentanyl and other narcotics. So how would you recommend, or if you could give some insight on how would I get my medication refilled if I'm away from home?
So if you're traveling, you need to really understand your health essentials. That might be equipment, blood pressure, glucose monitoring if you're diabetic, CPAP machine if you've got sleep apnea. So I think that most people would know the equipment that they normally need. They need to make sure that gets packed, that they travel with that it doesn't just get packed in the checked-in bag, but actually gets placed into the bag that's carried on in case something untoward happens with your luggage. Nothing worse than that. It is possible to get refills filled while you're traveling. There's some tips and some techniques that you can do to be helpful. The first is getting your prescription transferred from your home pharmacy to the pharmacy where you are. If you speak to the pharmacist in your destination, they can often make this occur, but that often will take up to 3 days. And so if you need an immediate refill of your medicines, you need to speak to the pharmacist about getting an emergency supply. The thing that works most readily is if your physician who wrote the prescription in the first place is willing to provide an additional prescription and indicate that may fill early, particularly. That's something that can be quite helpful. But this is not going to work for all medications. Schedule 2 medications that are narcotics, stimulants for ADHD, anxiety medicines that are benzodiazepines, Ativan, Valium, are not readily transferable between pharmacies. And so they could be quite difficult. So if you're having challenges there, you're going to need to speak to your physician, have their office fax a new prescription or electronically send a new prescription in Texas to the appropriate pharmacy. But this can be very, very, very challenging if they're controlled substances. So the first step is obviously prevention, making sure that you bring your medicines, ideally bring it in a bottle that has your name, has the name of the medication, how it's administered. That works best, as opposed to putting your medicines in a little baggie or a whole bunch of medicines in a baggie, the folks at TSA can sometimes get a very, very difficult position with that. Again, if you're traveling for longer periods of time, ask for a medication order, ideally on paper if that's still available, or an electronic one with early refills. And you're really going to have to plan ahead if you're traveling outside the country. Every destination will have different rules about what you can take and what you cannot. It's more transferable. Medications can be carried on your person for domestic travel, but again, if you're traveling overseas, there may be very, very specific rules. If you have a pharmacy in your insurance network, that's helpful. If you have a pharmacy at the destination that's in the same chain as your home pharmacy, that can be quite useful in transferring the medications more readily.
Again, that is incredibly useful information. I'm sure many of the listeners will definitely take note of that, either for themselves or for family members that they may be responsible for. And my next medication question is for Dr. Higgins. Being a psychiatrist, in fact, I have, two of your close friends, Dr. Jermaine Hawkins and Tim Benson, both psychiatrists, were good friends of mine. And I had shared a lot of moments with them, where they were doing psych emergency. They were on call for psych emergencies. So my question for you is, would you recommend, or how would you advise individuals, maybe they're feeling a little bit more depressed on the holidays, or they're taking pain medication, they decide, I'm just going to take one extra of that medication for anxiety or depression because I'm feeling a little bit more depressed. What are some of the risks of actually doing that, of changing your medication during holiday season or while you're on travel?
Well, the fact is that you don't want to move around your medication is based upon how you think you feel. You want to make sure that you talk it over with your doctor. Let your doctor know if you're having more problems or struggling during the holidays, or if you're having a more difficult time. As we know about these fentanyl overdoses, the numbers are going through the roof. And you even look at some of the artists that we've lost because of taking the dose at the wrong dose, or not knowing what the dose is. Sometimes the pills can get confused and things of that sort. So it's very dangerous to do so. So I would recommend stay in contact with your doctor. If you're feeling more stressed, if you're feeling more anxious, or if you're not able to sleep, or you feel like you're just flat out losing it, contact your physician before making those type of decisions, because these are controlled medications. That's why a doctor has to write the prescription, because they're trained to know what nuances to look out for. And when you take that into your own hands, you can actually get yourself in some serious, serious trouble. So even if you're out of town, you can always call your doctor. There's normally a way to contact your doctor under short order, even on holidays and on weekends. I know for myself, I only tend to get contacted about controlled substances on holiday. Normally if it's a phone call, like I need more of something, is normally a controlled substance. So we have to be very cautious of, risk of dependency and addiction, and what are we using that medication for if we're just increasing it around certain periods of time. Another thing is, if you're out of town, there's always an urgent care or an emergency room. If you find yourself getting into some sort of trouble, if your blood pressure is way out of whack because you forgot your medication, there are medical services wherever you go. And then, as Dr. Narcisse talked about, if you did forget your medication, it's best to go to a place that is that's in the same pharmacy chain, because they can look up what you were on. And, even though granted, it's going to be very difficult to find your doctor on Christmas Day or Christmas Eve, assuming that it's not one of those days, give a call to the office, and sometimes they can call you in something that you can go ahead and get filled wherever you're at. So you got to plan ahead. Sometimes we forget our medications at home. But if we do something like that, make sure that we try to mitigate our risk by contacting a doctor, trying to stay on the medication, following up with the pharmacy, and then also you have your urgent care or that is nearby wherever you need a medical service. Again,
Great information. I'm sure the listeners are going to really take heed to that, because again, that can be game changer. The key takeaway I learned tonight is, bottom line is that the way of preventing bad things from happening during the holiday season is to know your own risk. And no one is going to care more about your health than you, because you only have one body, and the consequences can be dire. I would like each of our panelists and followed by our Surgeon General to just any final thoughts. So we'll start off with Dr. Narcisse. Any final thoughts on how we can stay healthy, healthy mind, body, and spirit during the holiday season, so that we live to see another year?
Excellent. Again, know your limits. Making sure that you are paying attention to your sleep, making sure that you're paying attention towards your eating. One of the things we haven't talked as much about in Louisiana, especially, there's alcohol. It's in great abundance. We drink more of it during the holidays. That might be a thing to reduce and maybe even avoid if possible. But definitely paying attention to your limits, I think, would be a useful thing. Plan your holiday travel carefully. Make sure that you're bringing your medication, that you have a clear idea of your travel itinerary, and that you're going to make sure that you have enough time to have patience, because everyone, if you're traveling the day before Thanksgiving, everyone is in a rush. Everyone's trying to get to their destination in time, and it's always a challenge. I'd like to just give one quick final recognition. November 16th was my home chapter, my initiating chapter of Roy Oda's Charter Day, 32 years. Upcoming in a week and a half is the 94th anniversary of the chartering of my current chapter, Alpha Eta Lambda. I'd like to recognize those brothers and their accomplishments and their activities. Thank you so much.
Thanks for that, and definitely good luck during the holiday season, and really appreciate your thoughts. Okay, again, next is Dr. Higgins. Would you mind, just giving some final thoughts on how we can stay safe and maintain a healthy mind, body, and spirit during the holidays?
Well, what I would say, the first thing, make sure you get your vaccination. Please get your vaccination. It's clearly shown that vaccinations improve outcomes and decrease risk. You're more likely to live through all of this if you are vaccinated. Make sure you wear your mask. So even in family gatherings with everyone else, put your mask on, vaccinate so that you can keep yourself safe, and try not to get other people sick or ill. Make sure that you pace yourself, pay attention to your own body and have a plan. So trying to get more raw fruits and vegetables in, trying to get your water in, trying to get your sleep in, saying to yourself, you know what, do I need to get the fourth plate of Thanksgiving dinner? I've eaten a third of the pie. Do I need to eat half of the whole thing? Saying to yourself, you know what, enough is enough. I need to make sure I take care of myself because I want to be around for next year. Make sure that, it's okay to commune, but try to decrease the risk of the commune. So far as it's okay to try to be around family members, look at the risk. And if it's too risky, then don't do it. But if you are going to do it, always pay attention to the factors of how you can keep yourself safer and keep down the risk with everyone else. But the fact is that make sure you enjoy yourself, love yourself, do what you need to do to take care of yourself and the others around you.
Again, thanks for those final words. And again, I feel like I'm going to have a better chance of making it to next year just by a lot of the awesome advice that we've received. So again, I would like to turn it over to Dr. Sterling, Brother Sterling, the Surgeon General, for any final comments or thoughts or parting words. As an emergency physician, we definitely look for your wisdom.
I've really enjoyed the conversation, and part of what I want you guys to think of, I want to meet you where you are. This is the holiday season. This is a time for people to reflect on life and enjoy life. And we don't begrudge you the opportunity for you to do exactly that. We know that people are going to celebrate, they're going to imbibe, they're going to party and have a good time. I think that you should just be mindful. Part of what we always want to have you do is engage in a level of mindfulness at the beginning of your activities. Life is to be lived. We don't want to place limits on your living and enjoying of life. We just want you to be mindful and sensible about how you go about doing it. So when you sit down for that meal or that feast, just actually ask yourself, in the currency that represents my life, am I about to spend some of that currency intelligently? Am I going to do things that I will regret later, or am I going to do things that will add to memories that will serve me well when I'm in that rocking chair down the road? People actually die this time of year, and they die in high numbers. The suicide risk is much higher. The risk of things like DVT from traveling, the risk of congregating now in the era of the pandemic is higher. There's a thing called the holiday heart syndrome, which has been touched upon with congestive heart failure and other heart conditions, including heart attacks, myocardial infarctions. You should be aware of all of those realities and just make smart choices as best as you can. Know better, do better, and you'll be better. You don't have to eat the entire turkey. You don't have to drink an entire gallon of eggnog. You don't have to throw away the months of good habits that you've built up to gorge this time of year. So it's not a matter of everything in moderation. I want you to be empowered. I want you to be smart about the decisions and the choices that you make and be willing to accept any consequences that you have. I really want to thank the entire panel for this fantastic event, and want to remind you that next Thursday actually is Thanksgiving, so we get to take a break for once, and we will be joining you again on December 2nd, same time, same place, where we will be talking about HIV and AIDS. We'll be providing you an update on those diseases as well, but we'll also be talking about disparities that exist in populations afflicted by this disorder. So thank you. And again, on behalf of Alpha Phi Alpha and our General President, Dr. Willis Lonzo III, have a great evening. Be safe, be well.